Hey guys, it's Dr. Deeds from Deeds Health in Seattle, Washington, and today I am going to show you how to properly draw up Zepbound or Tirzepatide from a vial through the Lilly Direct program. All right, so we'll get shipped to you. It'll arrive in a box like this. There's 4 vials inside, which contain 4 doses. All right, so first, what you'll want to do is, wash your hands before you do anything else, but you'll find your vial. It comes in a little container like this, and we're gonna snap off the top, okay? And then you get an alcohol wipe, and we will clean off the top of the vial. Now, it is clean because of the way it's shipped and it's brand new and you're opening it, but I always find that's kind of best practice, especially if you are inserting a needle twice for some reason, if you messed up the first time. Okay, and then what you'll need are these little insulin syringes. They come in 0.5 milliliters or full milliliters. And so we open the package there and we get out our syringe. This side has the plunger part, take off the cap, and then this side has the needle. So we'll pull that part off. You'll see very tiny little syringe there. It's kind of hard to see, it's blending in. And so what we'll do is carefully insert the needle into the top of the vial, and then grab the vial, and you actually want to flip it upside down here to get the liquid out. Okay, and so then all the fluid will be at the bottom of the vial, and with your other hand, while you're kind of holding both the vial and the syringe, and I'm right-handed, so I'm holding that in my left hand, my non-dominant hand. Then I'm pulling with my dominant hand on the plunger. Just kind of carefully pulling that down until I get to the right amount that I need, which most people would be filling this whole thing. So it's the half milliliter. Great. And then we'll set it back down and carefully remove the needle. And now we would be doing the insertion. And that's it. So I'm just gonna recap this to show you the next step. So then what you're gonna do is find a location where you're going to insert the needle and administer the medicine. So most people are gonna do this on a leg, like your thigh, upper thigh, or your abdomen, somewhere where you can grab a lot of subcutaneous tissue. And so what you'll do is you'll pinch the skin with your non-dominant hand, kind of give it a pinch, kind of get it tight, or bring it up into the area where you're gonna insert the needle, and then you just wanna go perpendicular to where you're injecting into the skin. Doesn't have to be perfect, but that'll give you the cleanest results and less likely to bruise. And then push down on the plunger and inject it into your skin. And then when you're done and you've finished, I would put this into my sharps container, or however you can safely dispose of needles, but I recommend kind of ordering a small sharps container to do that, having some alcohol pads or wipes, and then if they didn't send you the syringes, that might be something you need to pick up as well. I hope you found this helpful, and that if you have questions, certainly talk to your doctor. They might be able to help answer them, but it's pretty straightforward, and after you do a few times, most people get the hang of it and find it pretty easy to administer on themselves.